Good morning. We will start with a new chapter in general pathology. It's neoplasia. This is the first lecture of the neoplasia. I'm going to give you about 85 slides or more than 85 slides of neoplasia divided into 2 or 3 lectures, and then Dr. Manar will be followed me to give you the last 35 or 40 slides of neoplasia. I hope you will enjoy this new chapter with the new concepts and new facts in pathology. The objectives of this of the neoplasia include the definition of a tumor. What is the tumor? When you hear about the tumor, so what will jump in your mind about the tumor? Type of the tumors, including benign, الأورام الحميدة. Tumors mean الأورام. It is mass, كتل تظهر بالجسم. The feature distinguishing between the benign from the malignant tumors. الخصائص اللي تفرق الأورام الحميدة عن الأورام الخبيثة. Sarcoma versus carcinoma. What is the meaning? Both of them are cancer. اثنيناتهم سرطان. But what is the meaning of the sarcoma? The cancer which arises from the mesenchymal tissue, whilst carcinoma is the cancer which arises from the epithelial tissue. Paraneoplastic syndrome. This is the topic that, or the entity that would be discussed separately in the slides. Dysplasia. What are the meaning of the dysplasia? The changes in the type of the cells, the changes of the cells that might lead the grading of it, mild, moderate, and severe, that might lead to the development of the cancer. Hereditary cancer, there are certain types of the cancer that are carried or run in the families, as in the colon cancer or the endometrial carcinoma or others. What are the genes that are responsible on these cancers? Gene mutation that lead to development of the cancers. Etiology of the cancers. What are the factors that promote or induce the development of the cancers, including the oncogenic viruses, DNA viruses, RNA viruses, the type of the viruses. Each one has its own tumor type. The chemicals, the radiations, chemicals, and others. Grading systems from well-differentiated, moderately differentiated, and poorly differentiated, and the staging of cancers. All of these, this is the most important topics that would be included as an objectives in the chapter of neoplasia. Introduction. Cancer is a leading cause of death in many countries. It is the second cause of death in USA after myocardial infarction. And of course, it is also the common causes of the death even in the Middle East and in all over the world. Some cancer, as example in Hodgkin lymphoma, which is a malignant tumor of the lymphoid tissue, are curable. If we diagnose this tumor or this cancer in early stages, the patient might be cured. And other type of the cancer, such as breast cancer, also, if the patient detect the cancer of this patient in the early stages of the tumor, so that it might be up to 95% of the cases would be cured. Therefore, screening tests and the scanning of the patient, especially those female patients by mammogram and ultrasound, is very important and mandatory in many countries nowadays in order to detect the cancer in early stages, to treat the cancer and to cure the patient. Some cancer of the lung and pancreas actually have high mortality. There are certain definitions that we have to know. Neoplasia literally mean new growth. Neoplasm or tumor is an abnormal mass of tissue, the كتلة, a growth of which exceed and uncoordinated with that of the normal tissue, and it is persists in the same excessive manner after cessation of the stimuli which evoke that changes. So there is loss of the responsiveness to normal growth control, resulting in continuous proliferation of the cells. Actually, this means that this is a mass, كتلة, present in any organ or in any tissue of the body, brain, liver, GIT, stomach, breast, kidney, whatever. The growth of this is uncontrolled because it is not response to the normal growth control. There is loss of responsiveness. It's haphazardly a growth of the abnormal proliferating cells with abnormal size and abnormal shape of the cells, high NC ratio, nucleus, large nucleus, comparing to the cytoplasm of the cells. Actually, this is with the high mitotic figures, sometimes especially in the highly aggressive tumors. The persistence of this growth even after cessation of the stimuli. What does that mean? Patients have, as we said, in the cell injury or cell that in hyperplasia, sometimes endometrial hyperplasia due to the uncontrolled or the imbalance in the hormones. It might lead to the atypical if the persistence of the or unopposed estrogen. It might lead excessive estrogen in the body. It might lead to the atypical endometrial hyperplasia. This would subsequently might lead to the development of the cancer, endometrial cancer. Even if we remove the stimuli that evoke that changes, but these changes persist, does not disappear. All tumors, whether benign or malignant, have two basic components. First, the neoplastic cells, the parenchymatous part of the tumor, would determine the biological behavior of the tumor from which the tumor derives its origin. As example, if the tumor arises from the hepatocyte in the liver, so it is called hepatocellular carcinoma. So there are certain characteristic features or biological behavior of the tumor according to the type of the cells or the tissue that it might arise from it. Second component is the supporting host-derived non-neoplastic stroma, supportive elements or supportive tissue, which made of connective tissue, blood vessels that supplying the tumor and that help the tumor or they assist the tumor to grow and to provide the support of the growth of parenchymal cells. It is important, these blood vessels and this supporting non-neoplastic stroma, the neoplastic cell component or the parenchymatous cell is the neoplastic component. Here, the supporting element are non-neoplastics, yani connective tissue, stromal fibroblast in between the tumor cells or the blood vessels that are non-neoplastics. But they are important in the maintain the growth or the support the growth of the parenchymatous component of the tumor. Division of tumors into benign and malignant categories. This is very important because according to the type of the tumor, the potential clinical behavior and the biological behavior of the tumor take place. The characteristic features of the benign tumors and malignant tumors. Benign tumors are innocent, it's harmless, localized unless it is grow in the organ that is a vital organ, as example in the brain. So it might affect by the compressing into the surrounding structures, but generally it's innocent. Localized, so it does not spread into the other side. It is persists in the same place without any invasion, without any metastasis. Amenable to the local surgical removal. That means it's easily or surgically removed, can be removed totally. If sometimes like in Fibroadenoma shell out of the يعني ينقلع من مكانه by surgery, so it easily because it is not invading. There is no finger-like projections or the invasive component that make it difficult or hard to be removed. Patient generally survive when patient has benign tumor, generally there is no, it's harmless, as I said, unless it is present or it's grow in vital structures that might lead to the compression of the vital centers. Malignant tumors, aggressive, it's really harmful because it's aggressive. Even the shape, in addition to the criteria, the above the criteria of benign tumor, most of the benign tumor are well differentiated, that it resemble the cells that the tumor arises from it. The malignant tumors, aggressive, nerve, even the shape of the cells are ugly looking. The nucleus is large nucleus, high NC ratio. Sometimes there's cross chromatin. Sometimes there is mitosis, atypical mitosis, and etc. We will come to all of these points and all of these features thoroughly in the next slides. Invasive, of course, there's invasive component like finger-like projections, which are arising from the main the tumor or cancer, the invading to the surrounding structures, make it very, it's not easily to be or amenable to surgical removal. Therefore, all the malignant tumor, when removed by surgery, we have to take a safe margin, in order to be sure or to assure that the patient, this tumor is removed completely. Capable of spread to the distant structure, which is one of the most important features of the malignant tumor. Most of the malignant tumor capable to spread to metastasize by the metastatic deposit into the distant structure, remote organ. That is mean when the tumor, as example in the lung, squamous cell carcinoma, the same type of this tumor, squamous cell of the carcinoma of the lung, metastasized to the brain. So this is the meaning of the metastasis. May be fatal, of course, because if it's fatal if it's interfering with the function of the organ, it's interfering with the blood vessels, maybe lead to the hemorrhage, maybe lead to the ulceration, maybe impairment to impair the function of the organ, or maybe enlargement because the malignant tumors enlarged more rapidly than benign tumor in most of the cases, so it might lead to the compression of the blood vessels and etc. They are actually the malignant tumor, and of course the metastasis. If the malignant tumor metastasized, it would be really fatal, and the patient might die of this tumor. Nomenclature of the benign tumors. In general, benign tumors designated by attaching suffix "oma" to the cell type from which the tumor arises. As example, when benign tumor arising from the fibrous tissue, it is fibroma, while those originating from the cartilage, it's chondroma. Nomenclature of the benign epithelial tumor might be more complex. The papilloma, which are the benign tumors of the epithelium growing on any surface. It is the papilloma. It appears as a finger-like projections, as example in the squamous cell papilloma of the skin, or in the wart, which is الثقاليل اللي تطلع بالجلد, or sometimes transitional cell papilloma of the urinary bladder. When there is adenoma are the another benign tumor of the glandular epithelium. It might be seen in the colon, might be seen in the stomach. It is called Adenomatous polyp. Tumor sometimes derived from the gland in the adrenal cortex, thyroid, liver, renal cell adenoma. Those tumors resemble glandular tissue both structurally, morphologically, and functionally. Squamous cell papilloma, the skin wart, which caused by the human papilloma virus, the most common type of the virus that causes skin wart is type 6 and 11. So look at here, look at the changes, cytological, so our cytopathic changes that the virus can make in the tissue or in the skin. Here, the skin is showing papillomatosis, hyperkeratosis, and also acanthosis. That means that increased thickening of the epidermis. Here also is the papilloma of the larynx, which is usually this is a benign tumor that might arise in the larynx of the patient, also caused by the human papilloma virus. This is a thyroid adenoma, another benign tumor that arises from the glandular epithelium, and that might arise in the thyroid tissue or my adrenal or liver or any other glandular tissue that this adenoma or benign tumor might arise from it. This is also a thyroid adenoma, a benign tumor of the thyroid tissue. Actually, this determination whether this benign or malignant in the thyroid tissue depend on whether there is vascular or capsular invasion of the tumor. Generally, these are the benign adenoma of the thyroid, but we have to confirm the diagnosis by the histopathological examination, because in the thyroid neoplasia, we should confirm this approach by confirming the diagnosis through the histopathological examination and to see whether the neoplastic follicular cell invading the thyroid capsule or infiltrating the blood vessels. Actually, the most common type of the cancer in the thyroid is the papillary thyroid carcinoma, which is sometimes accidentally discovered. And by the routine examination, most of the patient, it's more common in the female, and at the same time, it is most commonly in the young age groups, about 40 years of age. This is a microscopical view of the adenoma or adenomatous polyp, benign polyp of the colon. Here, the glandular epithelium, and this is a stalk or the pedicle of the pedunculated polyp or adenomatous polyp of the colon. This is a colonoscopic view of the colonic adenomatous polyp. Look at the pedicles here, and the stalk of the adenomatous polyp. And from this appearance, the well circumscribed, and this is a smooth surface. There is no generally or basically the malignant tumor not look like this. It look like more variegated, more irregular out surface, or and there is the attachment is broad attachment to the underlying structures where there is necrosis, there is hemorrhage. Here we can see that this the polyp is grossly looking benign. However, the histopathological examination is a must in all the polyp that removed from the colon. In some instances, however, the stem cell may undergo divergent differentiation, creating mixed tumor. We have two best examples. First, from the salivary gland, it is called Pleomorphic Adenoma of the salivary gland, which is one of the most common benign tumor of the salivary gland, because it's the component composed of the epithelial component with dispersed throughout fibromyxoid stroma, which is appear with the island of the fibrofatty tissue or cartilage or bone. All these diverse elements are derived from the myoepithelial cells of the salivary gland. Other type of the benign tumor that arise that have divergent differentiation, fibroadenoma, two-component fibrous tissue, and the adenoma, the glandular epithelium elements or the ductal element, proliferated ductal elements embedded in the fibrous stroma. So it's called fibroadenoma, the most common benign tumor of the breast tissue. And there is other tumor in the ovary, might be seen, or in the pancreas, cystedinoma. It is hollow cystic adenoma, commonly seen mucinous or serous cyst adenoma. This is a microscopical view of the fibroadenoma. Look at the epithelial component here, the ductal component, epithelial tissue, and associated with the stromal elements. This is a stroma, which is composed of the fibroblast or myofibroblast. This is a mixed tumor of the parotid gland, which is a pleomorphic adenoma. It's a benign tumor of the salivary gland, which is patient presented with the swelling in the side of the face, or the side of the just beneath the ear, because of the parotid gland here. This is a parotid gland tumor, pleomorphic adenoma. The gross appearance of mixed tumor, pleomorphic adenoma of the parotid gland, appears as hard tumor arising in the salivary gland. This is a tumor which is this is actually more cartilaginous tissue, because the mixed tumor is composed of the epithelial elements and with mesenchymal tissue composed of the might be bone, might be cartilage, or myofibroblast elements. This is a histopathological examination of the mixed tumor of the parotid gland. Epithelial cells appear as ducts with this secretion, and this is a myxoid stroma that resemble cartilage. This is cystedinoma of the ovary. It is benign tumor of the ovary, which is appear as a cyst adenoma, also epithelial component with the cystic dilated cystic structures. Teratoma. This is another tumor that arises from the totipotential germ cell, which is present normally in the testis or in the ovary, or sometimes it is abnormally sequestered in the midline of embryonic rest. Such cells have capacity to differentiate into any cell type found in the body. Therefore, in the teratoma, we might see the tissue arising from the ectoderm or from the endoderm or from the mesoderm. It is a mixture of skin, hair, fat, bone, teeth, mucosa, cartilage, muscle, neuron, and etc. Most of the teratoma of the ovary, if not all of it, are benign, while the teratoma in the testis is always considered immature or malignant, according, of course, to the differentiation of the tissue that are found in the tumor. So, well-differentiated mature, benign, mature cystic teratoma. All tissue components are mature and benign, which is most commonly seen in the ovary, while undifferentiated, immature, malignant tumor teratoma is always considered malignant. As example, the teratoma that are arising in the testis, which is the second commonest cancer of the testis after the seminoma. Seminoma is the most common cancer of the testis. This is a dermoid cyst, ovary, mature cystic teratoma, showing three component of the germ cell. This bone, this is a teeth actually, this is a sebaceous material, hair, bone, cartilage. This is a teratoma or benign cystic teratoma, mature cystic teratoma of the. This is a microscopical view of the mature teratoma or dermoid cyst of the ovary, showing this is a cartilage. This is a thyroid tissue, which could be seen in the patient with the mature cystic teratoma, and all the other components that are present in this type of the three component of the germ cell, ectoderm, endoderm, and mesoderm. This is testicular teratoma, which is appear as solid and appear malignant or considered immature. So it's never considered benign, in patient with testicular teratoma, unlike it's the counterpart component that are present in the malignant tumor nomenclature is achieved by addition of suffix sarcoma to the mesenchymal cells. Mesenchymal cells mean the fibrous tissue or blood vessels or cartilage, bone. So in the bone, osteogenic sarcoma, in the cartilage, chondrosarcoma, in the adipose tissue, liposarcoma, or carcinoma to the epithelial cell like squamous cell carcinoma, adenocarcinoma, and etc. So sarcoma basically are malignant tumor rising from the mesenchymal tumors or its derivatives, designated by their histogenesis, that to say cell type that are the tumor are composed of. As we just said that malignant tumoral fibrous tissue is called fibrosarcoma, chondrocyte, chondrosarcoma, angiosarcoma from the blood vessels. From the bone origin, osteogenic sarcoma, which commonly happened or developed in the young age group. Those tumors arising from the epithelial component are called carcinoma. As we said, squamous cell carcinoma, basal cell carcinoma, usually the basal cell carcinoma of the skin. Those arising from the glandular are called adenocarcinoma. This slide showing that according to the name of the tissue, histogenesis, that's the name of the tissue or the origin of the tissue, the benign tumor might arise or malignant tumor. As examples, squamous cell given to squamous cell papilloma, which is benign skin tumor, or even it's not a skin, maybe due to the any epithelial, any organ or any tissue that lined by the squamous epithelia, or squamous cell carcinoma in case of malignant tumor. Basal cell papilloma or carcinoma. Thyroid, follicular adenoma and follicular carcinoma. melanocyte nevus اللي هو الشامة يسموها، أو malignant melanoma in case of malignant tumor. Kidney, renal cell adenoma, renal cell carcinoma. Breast, fibroadenoma or ductal adenoma. There is invasive ductal carcinoma and invasive lobular carcinoma. Mesenchymal tissue in case of the bone, fibrous tissue, smooth muscle, striated muscle, and fat cartilage. Fibrous tissue, fibroma, fibrosarcoma. Smooth muscle, leiomyoma, leiomyosarcoma. Skeletal muscle, striated muscle, rhabdomyoma, rhabdomyosarcoma. Fat cells, lipoma, liposarcoma, and bone, osteoma or osteoma and osteogenic sarcoma, cartilage, chondroma and or chondroblastoma, and this in case of the malignant tumor is chondrosarcoma. The characteristic of the benign and malignant tumors, generally, there are reliable criteria which distinguish between the two. Tumor can be distinguished on the basis of differentiation and aplasia, that's patient. What does that mean? That the tumor, we know the origin of this tumor because it's arises from the cell or these tumor cells resembling the cell of origin. Rate of growth, when there is rapid growth or there is slow growth. Local invasion, which is the characteristic features of the malignant tumor, and the metastasis also is the characteristic feature of the malignant tumor. First, differentiation and anaplasia. Differentiation means the degree of resemblance of the tumor parenchymal neoplastic cell تشبه cell of origin morphologically and functionally. Benign tumors are composed of well-differentiated cells that are closely resemble the normal original tissue, while malignant tumor characterized by wide range of differentiation, well-differentiated and moderately differentiated and poorly differentiated, and two, sometimes undifferentiated, that cannot recognize from which cell of origin that this tumor arises. Therefore, immune histochemistry, immune stain is very important to apply into the tissue, the tumor tissue, in order to know exactly from where this origin or the origin of this tumor arising from. The anaplasia means no or there is lack of differentiation, which is considered hallmark of malignancy. So anaplasia is considered the hallmark of malignancy. Malignant cell display or showing maxillar pleomorphism. What is the mean of pleomorphism? Mean variation in the size and shape of the cell. Sometimes giant cell can be seen. Sometimes there is multiple nucleus, enormous nucleus, large nucleus, abnormal looking. Sometimes the chromatin in the nucleus, coarse, clumped, and the nuclei large and conspicuous. NC ratio, large nucleus. The nucleus ratio, the nuclear cytoplasmic ratio is 1:1 instead of being normal 1:4 or 1:6. Mitosis also are numerous and sometimes seen atypical. Multiple spindle may be seen like tripolar or quadripolar. Loss of polarity. Failure of the cell to develop in a pattern, recognizable pattern of the orientation. This haphazard arrangement of the cell, the loss of the pattern. And the P may be grow in the form of the glands, maybe form of the sheaths, in the form of the nest. So there is totally loss of organized structure. This is a well-differentiated squamous cell carcinoma of the skin. Tumor cell strikingly similar to the normal squamous cell epithelium of the skin. There is intercellular bridges, if you see these, intercellular bridges in between the epithelial cells with the nest of keratin pearls. This is a keratin pearls, which is the characteristic feature of the differentiated squamous cell carcinoma. This is actually an aplastic tumor of skeletal muscle. This is a rhabdomyosarcoma, marked nuclear cyto and cellular pleomorphism. There's change in the size and the shape of the. It's really highly pleomorphic because each type of the cell is different from the size and the shape from the other. And the nucleus is large, coarse chromatin. So there is giant cell, abnormal, atypical giant cell that are present here. This is atypical mitosis. Also, there is anaplastic tumors, that to say variation in the size, and that this is cells is different from the cells and shape and the prominent feature here in this slide showing the tripolar spindle mitosis in the center of the this is tumor, which is atypical, and it is that means this tumor is more aggressive behavior than other tumor which devoid of or lack of this mitosis. Rate of the growth: most benign tumor grow slowly, while malignant tumor grow much faster and eventually spreading locally and to the distant site by the metastasis, sometimes causing death. There are certain exceptions, but some benign tumors grow more rapidly than malignant tumors. The rate of growth of leiomyoma of the uterus is influenced by the hormonal level of the estrogen. So they might increase rapidly during pregnancy or cease growing in atrophy. Let's say atrophy and become largely hard and fibrotic, collagenous after menopause. Adequate blood supply, possibly pressure, also may affect the growth rate of benign tumor. As example, in pituitary gland adenoma, this is an adenoma or the benign tumor of the pituitary gland in the brain, which locked into the sella turcica, sometimes shrinked suddenly, presumably due to the wave of necrosis because of the progressive enlargement without compress the blood vessels, which lead to the necrosis, and subsequently that might lead to the shrinking of this adenoma. Local invasion, the third characteristic feature of the tumors. Actually, the benign tumor remain localized at the site of origin. So if one diagnosed by the benign tumor, like fibroadenoma in the breast, and then after a few months, patient discovered that we have found that the patient has metastatic breast carcinoma, or the infiltrative ductal carcinoma of the breast, in the lung, in the liver, بالكبد أو بالرئة أو in the brain. We have to get back to the slides of the previous benign tumor, or supposed to be benign tumor, in order to confirm the diagnosis. This, because this might be, we misdiagnosis. The diagnosis has been wrong. It was malignant, but we diagnosed the case as a benign, which is one of the fatal mistake actually, because in such a case we might lose the patient. Instead of being surgical removal of the tumor by surgery, and we lose the patient, but because when we remove the benign tumor, the patient no need to be followed up, no need to be investigated by mammogram or investigated by ultrasound. So in such a case, we may lose the patient. Instead of surgical removal of the tumor and then subsequent treatment with a chemotherapy or radiotherapy, in benign tumor, when we shell out the tumor, we don't need even to followed by the chemotherapy or radiotherapy, because it is actually a benign tumor. So no need for further investigation or further treatment. So we have to be more careful when give diagnosis of benign tumor, in order not to lose the patient, because the patient, if then we found that the patient has malignant tumor and we misdiagnose, or our diagnosis was wrong, we might lose the patient, and in such a case, this is one of the fatal mistake in the pathology. So benign tumor has no capacity to infiltrate or invade or metastasize to the distant site, as do cancers. The encapsulation or the formation of the fibrous capsule is one of the characteristic of the most of the benign tumor, as fibroadenoma, lipoma, thyroid adenoma. Capsule probably derived from the stroma of both the tumor or the original tissue. But not all benign tumors are encapsulated. Not all the benign tumor has capsule. As example, which the type of the benign tumor that are non-encapsulated or unencapsulated is the leiomyoma of the uterus. It is well demarcated from the surrounding by zone of compressed myometrium, with well-defined cleavage plane, that make the surgical inoculation or shelling out of this tumor is possible. Few benign tumors are also neither encapsulated nor demarcated, as in hemangioma. Malignant tumors are usually non-encapsulated and tend to invade the surrounding tissue. However, there مثلا fibrofollicular carcinoma of the thyroid gland have a thick capsule. So the capsule, however, it is a feature of benign tumor, but not all benign tumors are encapsulated, and not all the malignant tumor are non-encapsulated, because sometimes, as we said, that the follicular carcinoma of the thyroid gland has a thick fibrous capsule, and it is very important in the diagnosis of the follicular carcinoma in the thyroid gland. This is a leiomyoma of the uterus. Look at this. Multiple leiomyomatous, and encapsulated. There is no capsule. This is no capsule. This is a invasive ductal carcinoma of the breast. Look at this malignant tumor. There is no capsule, non-encapsulated, and it is infiltrated. Look at these finger-like projections arising from which give or the clue that this tumor is invasive. It's actually stony hard because of the presence of the collagenous Dysplasia syndrome. Metastasis. It is important characteristic feature of malignant tumor or malignant cancer. Metastasis means spreading of a tumor. There is secondary implant. There is metastatic deposit in remote tissue, which is discontinuous from the primary tumor. Benign tumor do not metastasize, never metastasize. Cancer have different ability to metastasize. At one extremes, basal cell carcinoma of the skin and most primary tumors of the central nervous system are highly invasive in their primary site, but rarely metastasize. Some of the tumor, so the capacity of or the ability of the tumor to metastasize are different. At the other extremes, osteogenic sarcoma, which is the malignant tumor of the bone, rapidly metastasize. So it tends to metastasize to the lung at the time of the diagnosis. Therefore, the patient, when you have osteogenic sarcoma, we have to do full or thoroughly investigate the patient by doing PET scan or CT scan in order to know if this tumor already metastasized to the lung or no, because this is very rapidly metastasizing tumor. About 30% of newly diagnosed solid malignant tumor present with clinically evident metastasis. There are certain additional 20% of the occult hidden primary that we discovered the metastasis, but we cannot at the time of the diagnosis, but we can't discover the primary tumor. That primary tumor is already hidden. This is called occult carcinoma. The malignant tumor disseminates by one of three pathways: by lymphatic spread, which is the most commonly route of spreading of the carcinoma, epithelial tumors; hematogenous spread, which is most commonly the route of the transmission of the sarcomas, seeding within the body cavities. So lymphatic spread is most commonly, which is typical of carcinoma. Lymphatic lack of the basement membrane, which is more readily and easily penetrated by the cancer cell than capillary. The lymph node involvement depends on the primary site of the tumor and the natural pathway of the lymphatic drainage at this site. As example, when we have sentinel lymph node, which is the first lymph node that are drain the tumor from in the breast. The biopsy from this sentinel lymph node, it is very important because allow determination of to see if the tumor spreading or no. However, sometimes when we take the sentinel lymph node biopsy from the breast, the tumor cell traverse the sentinel lymph node to be trapped in the next group, يعني يعبرها, traverse it, يعبرها, which is called skipped metastasis. The pattern of the lymph node involvement depends on the site of the primary tumor and the natural lymphatic pathway of the drainage at the site. As example, in the breast carcinoma, in the upper outer quadrant, spread first to the axillary lymph node because it is adjacent to it, while the medial side of the carcinoma of the breast, it drains into the internal memory lymph nodes, which is along the internal memory artery. However, all the lymph node of the body contains spreading malignant tumor, ultimately or finally reach the vascular compartment through the thoracic duct. This is a breast carcinoma. There is no capsule. This is infiltrative ductal carcinoma of the breast. non-specific tumor type. This is actually the lymphovascular invasion. Look at it. This is vascular and this lymphatic channel, and this is lymphovascular invasion, tumor islands. And this is sheets and cords of the malignant cells, which is invading the breast tissue stroma. This is also secondary carcinoma, which involving or invading the lymph node or metastasized to the lymph node, several mesenteric lymph node. The enlargement is caused by the presence of gray white deposit of the secondary carcinoma from the in this case is from the rectal adenocarcinoma. This is a tumor, small lung, small cell carcinoma of the lung in patients with the smokers. Look at it. The secondary, there are multiple foci of the tumor cells in the right lobe. These are the tumor of the small cell carcinoma of the lung, which is most commonly occurs in the or develop in the smoker patient. And actually, the small cell carcinoma of the lung considered one of the carcinoma that are metastasized at the time of the diagnosis. Therefore, the patient, most of those patients are treated by the chemotherapy because surgery is of no benefit. This is a malignant melanoma. Look at it. This is melanin pigment. So this is a black color because melanin laden secondary deposit of the malignant melanoma in the lymph node. The hematogenous spread is favored pathway for sarcoma as well for the carcinoma. Vein with thinner wall are penetrated more readily than the arteries, and with the venous invasion, the blood-borne follow the venous flow into that draining the site of the tumor. As example, the portal venous flow drainage to the liver, as in the cancer of the GIT. So the cancers of the GIT mostly metastasize to the liver. Systemic venous blood flow to the lung and bone. Therefore, the most common site of the hematogenous metastasis secondary is the liver, lung, and bone. There are certain criteria or propensity for the carcinoma that have tendency or tend to invade the vein. As example, renal cell carcinoma, which often invade the renal vein, which this is of course determine the staging of the tumor in renal cell carcinoma. This is very important. And the tumor or renal cell carcinoma grow in snake-like fashion from the renal vein to the inferior vena cava. That might reach the right side of the heart. Look at it. This is very certain weird route of the metastasis or the spreading of tumor. And the hepatocellular carcinoma as well, often penetration the portal and hepatic vein. Tributaries to grow within them into the hepatic vein and then to the inferior vena cava. This is a liver studied with the multiple whitish metastatic tumor. Actually, with this picture, as long as we see the multiple foci or the secondaries or the masses, multiple masses in the liver. So most commonly we have to consider that patient have metastasis because the primary tumor is usually solitary tumor, solitary mass involving the liver or any organ. But when we see multiple, so you have to be so precise, especially when you have a case. Clinical case عندكم حالة ممكن أو عندكم case multiple. When you say multiple tumor masses involving the liver, so you have to consider that patient might have metastasis to the liver rather than primary tumor, because primary tumor is rarely presented with the multiple masses. This is a neuroblastoma of the skull, which is secondary neuroblastoma. Look at it. This is neuroblastomas secondary deposit to the skull. As the neuroblastoma also have a propensity to involving or to metastasize to the bone. It is a neuroblastoma of the adrenal medulla, but have a propensity or tendency to bone metastasis. This is also secondary carcinoma in the vertebrae, which is most commonly involving the bone, prostate in the male, or thyroid, or in the breast. Also have those tumors have propensity to involve or to the metastasize into the bone. The route of transmission of or the spreading of a tumor, the third one, seeding, which occurs when the tumor invades the body cavity, as in case when the cancer of the ovary or the stomach or the colon that penetrate the gut wall into the covering serosa, malignant cell fall into the peritoneal cavity. So it reimplant at the distant site through a peritoneum, which called transcoelomic seeding or spread. Similarly, lung cancer can spread in the pleural cavity, CNS penetrate the cerebral ventricle, and sometimes it's carried by the cerebrospinal fluid to reimplanted on the meningeal surfaces, either in the brain or in the spinal cord. Cancer arising near the vertebral column often immobilize through the paravertebral plexus and may result in the vertebral metastasis of the carcinoma of the thyroid and prostate. So the thyroid and prostate and also the breast cancer are the most common. Kidney also are the most common tumors that have a propensity to metastasize into the bone and vertebral column. As regards the function, the better differentiation of the cell, the more completely it retains the functional capability found in its normal counterpart. Mean more well-differentiated cell or the tumor that we expect that this tumor have the same or functional capability of the normal tissue that it might arise from it. Benign tumors, even well differentiated carcinoma of the endocrine gland, frequently elaborate, secrete hormone characteristic of their origin. Well differentiated squamous cell carcinoma usually elaborate keratin, while poorly differentiated squamous cell carcinoma, we don't see the keratin, because as soon as we see the keratin, we can recognize the type of the cancer. It is well differentiated squamous cell carcinoma. Hepatocellular carcinoma, elaborate bile. There are certain functions that are unexpected to be emerged in some instances. As example, in hepatocellular carcinoma or in yolk sac tumors of the gonads, may elaborate elevated alpha-fetoprotein. Alpha-fetoprotein normally it's not found or it is not elevated in normal individuals. While when patients have hepatocellular carcinoma or sometimes yolk sac tumors, that these two tumors sometimes elaborate alpha-fetoprotein. This is in the adults. It is the detection of this alpha-fetoprotein is sometimes important to prove clinically usefulness in the reaching the diagnosis and in the follow-up of the patient if there is any recurrence. Some cancer of non-endocrine origin may assume hormone synthesis to produce so-called ectopic hormones. Lung cancer may produce insulin, so the patient with lung carcinoma, patient might have hypoglycemia, might have diabetes, might have hypercalcemia because of these abnormal ectopic hormones that might be produced by these tumors. More rapidly growing, the more anaplastic tumor, less likely to have specialized functional activity. Paraneoplastic syndromes. What is this? Paraneoplastic syndrome, they are a group of rare disorders that are triggered by an abnormal immune response to cancerous tumor known as neoplasm. Paraneoplastic syndrome thought to happen when this cancer-fighting antibody or white blood cells, known as T cell, mistakenly attack normal cells in the nervous system. These disorders affect middle and older age group, and most commonly those individuals who have lung cancer, ovarian, pancreas, liver, lymphatics, or breast. Neurological symptoms develop over a period of time, maybe days, maybe weeks, and sometimes prior to the tumor even being discovered, as I just discussed this fact in the previous slide. Symptoms include difficulty in walking, swallowing, loss of muscle tone, slurred speech, memory loss, vision problem, sleep disturbances, dementia, and etc. This syndrome include Lambert-Eaton myasthenia gravis, stiff person syndrome, encephalomyelitis, myasthenia gravis, cerebral degeneration, encephalitis, neuromyotonia, opsiclonus, and sensory neuropathy. Thank you very much. I hope you enjoy Neoplasia chapter of pathology.